Hey, welcome back to Not So Complicated, and this is episode 1 of Concise and Precise. We are doing neuroanatomy, and within that, we are doing cranial nerves first. So, this is olfactory now. We'll be talking about root and origin of the nerve, course, branches, functions, and lesions. So, let's begin without further delay. The root or origin of the nerve starts from olfactory receptor neurons in the nasal mucosa, that is olfactory epithelium. So the one true high yield point that you have to remember is that olfactory nerve is not a true nerve but a collection of sensory axons, and it is a part of central nervous system, and that is why this nerve does not have any branches out of the skull, out of the brain, right? So the course of this nerves, obviously the origin is olfactory receptor neurons in the nasal mucosa or olfactory epithelium, and these bipolar neurons, these neurons are bipolar, you have to remember that. These bipolar neurons extend axons to the cribriform plate of the ethmoid bone. So you can see in the figure here, so cribriform plate, that is like a part of ethmoid bone, and that has pores in it. These pores are used for these neurons to travel from the upper region of the skull to the nasal mucosa. So the synapse in the olfactory bulb in the forebrain, and then these olfactory bulb neurons, that is either mitral or tuft cells, from form olfactory tract, right? And anything that is sensed by the sensory system, that is smell, but that has to be interpreted in the brain to know, to recognize what smell is that, right? To register a new smell. That is why you need a reason in the brain to decode what smell it is. So that is why this olfactory tract project to olfactory cortex, that is piriform cortex or amygdala or entorhinal cortex in the brain, right? So this is the precise course of the olfactory nerve, and there are no branches as I have talked earlier, and this is the reference image you can see. The functions of this olfactory nerve are that it has a special sensory function, that is smell, olfaction obviously, and the supplies of olfactory nerve is that olfactory epithelium in the superior nasal cavity, and they detect odorants. Odorants are actually the molecules, small molecules that determine the smell of anything, right? So the lesions of this olfactory nerve are, there are causes and effects, right? The causes can be trauma, as in cribriform plate fracture, as in RTA or road traffic accident, or any other trauma, right? And then tumors like meningioma, esthesioneuroblastoma can affect the sensory smell. And then the infections like meningitis, they can traverse, right? The migratory infection can happen. And neurodegenerative diseases like Parkinson's and Alzheimer's, they affect the olfactory cortex like piriform cortex, and that is when the smell sense is not able to be decoded. And that is how, even if you smell things, even if your sensory nervous system smells and senses things, your brain cannot interpret in neurodegenerative diseases. Like, so the effects are anosmia, as in loss of smell, unilateral or bilateral, and parosmia, that is distorted smell, and dysgeusia, that is altered taste secondary to smell loss, right? And it can happen for risk of CSF, that is cerebrospinal fluid leakage, from with cribriform plate injury. The testing is done by smell identification test with standard modules like University of Pennsylvania smell identification test, and we have to avoid irritants like ammonia. So smell, certain specific smelling things are used in this test actually. So that is all. Subscribe for more clinical pulse, and thank you for staying with me. So we will be doing optic nerve next. Thank you.